Welcome back to the channel. My name is Ron Betta. I have created FitPro system to help personal trainers advance their careers to become the best possible trainer they can be. And I'm doing this because I've been in the fitness industry since 2002, and I've seen a lot of challenges that I don't think our personal training certifications set us up for. And one of these things is the medical component. There is a boundary between the medical field and the fitness industry. Okay. In both cases, personal trainers are in the health field, but they are not in the healthcare field. So it's important to recognize and delineate these two areas, because medical professionals here in the United States have to abide by certain laws, state laws, federal laws. There are certifications they have to take. There is a certain level of schooling they have to complete, certain scores they have to make, tests. They have to get the proper licensing. And then, of course, they also get malpractice insurance. Very important for them to have that, because they can be sued. They can be fined. There are lots of issues that come into play when it comes to being a medical professional. The personal training side of things does not have those limitations or those qualifications. They're not required. I've seen gyms that hire just about anybody, and that person says, I'm a personal trainer. And by the gym standards, they're a personal trainer. There are others that get certifications through organizations like the American College of Sports Medicine, the National Academy of Sports Medicine, the Aerobic and Fitness Association of America, whatever organization is out there that you want to get certified through. Preferably, it's a high-quality certification organization. And there are, of course, various levels of quality involved in that whole area, which I can say for a different podcast. But for now, it's important to recognize that a certified personal trainer, somebody that's gone through the process of learning, has a scope in which they can work. They cannot diagnose a disease. They cannot prescribe medication. They should not be prescribing dietary changes. They should be giving general health and fitness information. They should be talking about proper exercise programming. They should understand the client's medical history and medical conditions now. And if needed, and this is something I highly recommend, work with the client's physician to make sure that your programming is supporting whatever the client might be dealing with. Now, in some cases, you'll get a client that doesn't really go to the doctor very often. That's fine. As long as their medical history is clear and they've completed the PAR-Q, right, which is our way of kind of determining if a person's going to need a medical clearance or not. If they are clear to exercise with you based on the standards your organization, your gym has set up, then I believe you can safely train that person using the standards that your organization, your certification organization has set up. If they have a medical condition, let's say, for example, they have Parkinson's disease. I've had clients with Parkinson's disease, and I have gone to that client's doctor's office with them during one of their appointments so that I have a chance to speak to their doctor. Now, I can charge them for the session. I can charge them extra money if I want. I can do whatever I want in that sense, because it's my time. But I'm investing some time with the client to go to their physician's office, to talk to the doctor and say, my client has told me that he's been diagnosed with Parkinson's disease. These are the exercises that I am going to perform with the client. Do these exercises support this client and support your medical advice, or do they detract from it? Very important, because if it's something that you're doing that's going to make the client's situation worse, you need to stop. If it's something that's going to make the client's situation better, you need to continue that. But you need to be able to communicate that with the physician. And a lot of personal trainers will not do that because they have a fear of referring the person out to somebody else. You don't want to lose the client's business. You want to keep the revenue. You want to keep the client, with you as long as possible, right? And to me, this is a mistake, because if you refer the person to a physician and you get them the help that they need, they're going to come back to you because they're going to see you as a professional. Moreover, if you can get them results with that physician, the physician who has a laundry list of clients, they have all these patients, they might be able to use your services and refer their patients to you. So rather than seeing it as a threat, you should really be looking at it as something that you can use to pull more people into your business, because you can help more people if you have a relationship with this doctor. The same is true of physical therapists, chiropractors, anybody in the medical industry that you want to work with. You go to that person and explain to them, these are my certifications, these are the clients I tend to attract, this is my niche group, and I want to be able to refer them somewhere. Can I refer them to you? Now, at that point, the doctor is probably going to say, can I see your certification? Can I talk to you? We talk one-on-one, in the office. Sit down with the doctor and say, I want to refer my clients to you so that they can get the help they need. And then you can refer them back to me when you have an exercise plan. And now you have a communication, a dialogue going with a brand new resource for your business. So it's important to understand that you need to be very careful when a client is sharing medical information, that you are managing that information within the scope of your role, within the scope of your job. If they start to share information with you that concerns you, maybe it's something that they shared about medications that they're taking, or they're stopping their medication, whatever, you might need to step in and ask them more questions about that. Hey, I want to make sure you're okay. You need to make sure you talk to your doctor about what you told me today. You need to make sure. Sometimes they'll text me things. I've had clients text me information on their menstrual cycle, their bowel movements, their bodily functions, whatever. They text me all sorts of things, and I have to explain to them that's in the medical field, not in the fitness field. I'm here if you need to change your appointment. I'm here to help you with your bench press. I'm going to spot you when you exercise. I'm going to give you new exercises to do. I'm going to change things up so that your body is constantly, working to reach your goal. But some of the information you shared with me today is beyond the scope of my job, and you need to bring this up with your physician. And that's it. So keep records of that. Make sure if you do communicate that to the client that you're explaining that in written form for your files. You keep a file of that handy so that if there's ever a problem, you can go back and say, hey, on this date, I told the client to see the doctor. That's very important in terms of risk mitigation. You want to make sure that you're not going beyond a certain scope, and that you're keeping records when the client does, because they will share information with you that is medical in nature. And again, some of that might be relevant to their programming, but if it's not, or if it goes beyond, if they're asking you for things that you can't manage, then you definitely need to send them on to their physician. The last thing I would say about the medical boundaries is to keep them confidential. Here in the United States, there are HIPAA laws that prevent physicians from sharing information. They have to keep everything confidential, right? They have to keep the information the patient shares with them. They have to keep their medical diagnosis confidential. They don't share it. Again, those laws are out there to protect the client or their patient. And as a personal trainer, although you are not necessarily bound to the HIPAA laws, you should probably be following very closely to make sure that you are preventing anybody from gossiping. You don't want to share a client's diagnosis with anybody else in the gym. You want to make sure that anything they say to you is maintained confidentially. Now, if they're going to harm themselves or someone else, you definitely need to alert authorities. But if they are sharing with you information about their medical conditions, you do not want to let that information out. You want to keep their information locked up, secured. You don't want anybody else to see that. This is important for, number one, the business. You want to protect the business. You want to protect your reputation, which is also basically your business. You want to make sure that the client is not embarrassed. That's important. And this information that you have is very powerful. It can really do a lot of damage to a client if the information is released. So make sure you take care of that. In the case of doctors, how they transmit the information about their patients is monitored very carefully. They have to make sure that the information is secure, that their data is secure, that they keep everything locked up. If it's digital, that it's properly stored. If it's physical, that it's locked up properly in places where it's safe, so that the client's information, their patient's information, can stay confidential. That's going to be it for this one. I'm going to come back with some more information on other boundary types. We've got sexual and romantic, we've got attachment, we've got social. Those are the other three types. This was medical. I'll come back with more information. If you have any questions, go ahead and leave them here for me in the comments. I'll be happy to talk to you about them. Like the video, subscribe to the channel, please. It's going to help us. I'm just trying to get information out there to personal trainers to help them become better at their jobs. I want to elevate the personal trainers that are out there. I really want to elevate the industry by and large. And so I'm going to share this information with you. Once again, my name is Ron Betta, and I'll see you next time.